Thanks for introducing us. I'm Tinuke, co-founder of Five Times More.
And I'm Clo, the co-founder of Five Times More alongside Tinuke.
Today we're going to be talking about advancing Black maternal health outcomes over the years. Before we talk about that, we just wanted to give a quick disclaimer that the UK is still one of the safest places to give birth in the world. There's just a disparity in who is dying, and that is what we campaign for within Five Times More. And also to remember that Black women are not a homogenous group. We don't all think the same or have the same experiences, and we do not speak on behalf of all Black women. So, what is Five Times More? Well, we are a grassroots organisation that is dedicated to highlighting and changing Black maternal health outcomes in the UK. We take a four-pronged approach to the campaign, which we'll talk about later. And who are we? Well, I'm Tinuke. I'm the founder of Mums and Tea, which is a social platform for mums to connect. It's how I connected with Clo. I'm also the founder of Learning with Airs, which specializes in diverse educational resources for babies and toddlers. I've got two kids. I'm a mum. I've got two kids. My son Ezekiel was born in 2017. My son Ezekiel was born in 2017, and it was a terrible experience. I won't go into all of the details, but just to give you a high level, I had preeclampsia that was diagnosed very late. I was induced in the pregnancy and just had a bad experience of trying to bring Ezekiel out into the world. I realized that my bad experience was not one that was isolated. Through talking to other Black mums within running Mums and Tea, I found that this was a common occurrence. A lot of Black mothers were having terrible experiences, and I thought something needed to be done. So I joined forces with Clo, who's going to tell you a bit more about what she does, and we created Five Times More together.
So at the time when Tinuke contacted me, I used to run an organisation called Prosperities. We supported Black and South Asian mum during the pregnancy stage. So during pregnancy and 6 months after, so like the perinatal stage during the pregnancy, with free counselling support, community support. We used to go to their house and just support them overall during the maternity journey and their mental health. Currently, I am the MNVP chair of St. Thomas Hospital, which stands for Maternity Neonatal Voice Partnership. So what I do, I co-produce and co-design maternity services for Lambeth and Southwark. Okay, so earlier Tinuke said we have a four-prong approach to our organisation. The first one is we support women. So we support women with various of resources and things. So one of them is the 6 recommended steps. So earlier Priscilla talked about our selfie that we started, which was like this, and it stands for stop, but also at times 5 times more. The steps that we had was 5 recommended steps, and each fingers had a recommended step to go over it. We have now moved it to 6 recommended steps because we added additional steps that we felt that was really needed. We also have steps for partners. So if you're helping a woman give birth, you could be her, in terms of her birthing partner, this can be a family member, the father or the dad, or friends and family. There's steps that we have recommended that you should do, and we co-produce these steps with fathers. We got information on knowing your rights. So during pregnancy, what we realize, a lot of women don't know their rights. They don't know that they're allowed to have a second opinion. They don't know that if they want a certain type of birth or give birth in a certain place, that they're allowed to have that birth. So we have information on knowing your right. Same thing with how to complain, who to complain to, the procedure of complaining. We join forces with Positive Birth Company, and we give Black women hypnobirthing vouchers for free. So the hypnobirthing course actually costs £40, but we offer it to Black mums for free. We've got some information. We partnered up with Tommy's on when to call the midwives. A lot of the mums that we speak to always think that they don't want to call the midwife. They feel like they're wasting the midwife's time. So we have an information sheet to show them that this is when you should call the midwife. Don't feel like you're wasting our time, because we wanted them to advocate for themselves, but also empower them to take steps. We also have information sheet on questions to ask on your appointment, and there's many more. We have so much on our website. And it's all free of charge, and it's all about the partnerships that we have made with other maternity organisations. Then we go on to another part of our campaign is we train health professionals. I'm not sure if you can see the 2 health professionals on top. They have a small badge on their chest, and that badge has the hand that's like this and says, "I'm here to learn." And that's the name of our training. I'm here to listen, sorry, and that's the name of our training course that we have. So anyone who has passed our training course, because it was a 2 hours training course, and then those questions, anyone that passed the training course will get a badge. And what that badge represents is that you have taken the training course and that you're able to look after women. You know how the stereotypes that some Black women face, the myths that some Black women face, and you're here to actually listen, because a lot of the women complain about not being listened to. We've got the Colourful Birth wallets, and that we launched that within South East London. So the majority of hospitals in South East London all have our wallets. So the 2 health professionals at the bottom are holding our wallets. On those wallets, there's information on your well-being, when to call the midwife, the signs and symptoms, the risk, what you shouldn't eat, all those types of stuff. We've got those in those wallets. Those wallets hold your maternity note and any information that you get from your hospital or from your health professional, your GP about your pregnancy. Now, the wallets are additional support. So they're additional information and advocacy to help you advocate for yourself. So we always advise the women to read the maternity notes that they've been given and information they've been given by the health professionals, but also to have our wallets just for extra information if they need be. We collaborated with our COG, that's Royal College of Obs and Gynae, and we made health professional steps. So we have 5 steps that health professionals should do to better take care of women. And we do a lot of presentations and keynotes like today. The third part to our campaign is lobbying. We lobby the government, and that's something that we do a lot of. We have an MP, a letter writing campaign. We tell everyone to write to their MP. We had MPs, if you can see, there's MPs on top who signed up to our pledge. So we had a pledge where we told MPs that you'll pledge to put what's the word? Not statistics. What's the word?
Just things in place to help with the stats.
With the stats, sorry, to put things in place for the stats that we have. For them, because basically at the moment there's no measurement. So Black women dying or women dying in general, there's no target. So what we wanted the MPs to do is put targets to why Black women are dying. Because if you put a target on stuff, they work towards it. We got APPG meeting. APPG stands for All Party Parliamentary Group. That means it's different parliamentary parties. So it's Labour, Scottish Party, Conservative, all of them get together and talk about issues to do with Black women or Black maternity. And then we do debates in Parliament as well. So this is the 4th part to our campaign. We added it recently, and it's research and reports. We get asked to do a lot of research and reports, so we added it as part of what we offer with our campaign. So here's just some of the organisations that we worked with. Some of them I mentioned before, but here's some of them. Okay, is this my bit? Yes. So Tinuke mentioned before about the Embrace report and why we started. So here's the Embrace report. If you look at 2018, you see where it says Black women, it says Black women were 5 times more likely to die in pregnancy, childbirth, and the 6 weeks after, compared to white women. So white women, it was 8 out of 100,000. Asian women was 15 out of 100,000. And Black women was 40 out of 100,000. And this is why we are 5 times more, because if you put 8 times 4, it's 40. Now, so the recent report that's came out in 2023, and this is the statistics. So white women were 9.7 times more. So 9.7 out of 100,000. Asian women was 17.6 thousand. 17.6 out of 100,000. And Black women is 37.2 out of 100,000. So it has gone down slightly, but to us, it's still not good enough. And we feel like more needs to be done. And this is why we're still campaigning.
So, what are some of the issues and barriers for Black women within maternity? So, after, we said in the beginning, we don't speak for all Black women, but we certainly speak to a lot of Black women within the campaigning work we do and outside of that as well, and based on our own experiences too. We feel that Black women are not listened to and they're not taken seriously. Sometimes we're not believed when we're expressing ourselves, and there are very many reasons for this, including the history of Black women in maternity and obstetrics. Sometimes we're made to feel like we're uneducated or that we're spoken down to, and often it can feel like we're being gaslit if we say, I'm in pain, I'm in pain. And they say, no, it's all right, you're a strong girl, you can do this. Sometimes you can feel like you're a burden. So like Chloe mentioned, we've got a resource saying when to call the midwife. When is it okay to call the midwife? Because sometimes you might feel like, oh, I don't want to bother anyone, or I don't want to be a bother. So you feel like you can be a burden. And this can stop people from speaking up and seeking help. This very common stereotype as being loud and aggressive and angry, that stops people from actually speaking up, because sometimes Black women can be scared that they don't want to be labelled that way, so they just say nothing at all rather than wanting to be labelled as someone who's angry just for speaking their mind or saying that something doesn't quite feel right. Also labelled as strong and that they can handle pain. Again, this goes back to the history of Black women within medicine. Just to give you a quick whistle stop history lesson, Black women in the past, during times of slavery. So the godfather of gynecology is James Marion Sims. The Sims speculum is still used till today. So his work is still, prevalent in modern society, because people think, oh, slavery was all those years ago, but actually it still does have an impact on what we see today. And when he was perfecting that instrument, he used it on Black slaves, Black female slaves who were pregnant with no anesthesia, because at the time it was thought that Black women don't feel pain, are subhuman, and don't feel pain the way other people do. When he perfected the instrument, he did some really inhumane things to them, by the way, like under this notion. And when he perfected that instrument, he took it into the hospitals and used it with white women with anesthesia, so they couldn't feel the pain. So because of these damaging stereotypes as being strong and being able to handle pain, there are so many things that happen within that. We don't get as much pain relief if we ask for it, which something that we found within our research we'll talk about later. And just overall in general, people just think, yeah, you're a Black woman, you're strong, you can do anything. That's not true. We still bleed the same blood and we feel pain as well. Not being given the right information so that they can make informed decisions about their care. One of the consultations we held very early on in 5 Times More, we found that Black women were not being told information about where they can give birth, about their options. So that often that basically means that you're not able to make the best choice for you because you don't know what is out there. Please. It's all right. So we've got our parliamentary milestones. So in terms of what we've been trying to do to make sure those in power in government actually change the statistics. There's no point in obviously there's a point in raising awareness, but also you have to tackle it from the angle of making sure those in power can actually make those changes. So in July of 2020, in the year that everything kind of kicked off, isn't it? We had a petition that gained over 187,000 signatures to improve Black maternal health outcomes, which I'll talk about later. Over the time, we have submitted loads of evidence, given oral evidence and written evidences to various inquiries and select committees as well. In April 2021, we had a historical debate on Black maternal health. And in September, we launched the all-party parliamentary group on Black maternal health, which Chloe has mentioned before. There have been 3 debates in Parliament on Black maternal health because of the campaigning work that we have been doing. Next slide, please. So, our petition to improve Black maternal mortality rates in the UK gained over 187,000 signatures back in 2020, which meant that it was able to be debated in Parliament for the first time ever in Parliament's history. So, we feel like that was quite a big achievement for us in terms of getting it put on the map and getting Black maternal health discussed in Parliament. It did so well that we were nominated for Petition Campaign of the Year alongside Marcus Rashford, which I think was quite an achievement for us. Again, putting Black maternal health on the map. Next slide, please. On the 19th of April in 2021, off the back of our petition, there was a debate to speak about Black maternal health care and mortality. And within that debate, the Minister for Patient Safety at the time said that they had, what was it?
The women's strategy.
Yes, they wanted women's experiences on health for the women's strategy. And she said that women from Black and other ethnic minority groups were underrepresented in the responses that they had received, which we kind of knew they were going to say. And we basically wanted to preempt that and create our own survey, which we'll talk about, our report, which we'll talk about in a second. And as already mentioned, we have a Black Maternal Health APPG, which consists of MPs from the Houses of Lords, Houses of Commons coming together and doing whatever MPs can do to help raise the profile in their various constituencies, and also put in things in place to make sure that this stays at the top of the agenda in Parliament.
Sorry. So here's the Black Maternity Experience Report. This report gained over 134,000. Sorry.
1,314 women. That's having a day.
Yeah, that's having a day. So I got so sidetracked. And that was the biggest amount of responses from Black women's experience ever collected in the UK. So it's never been done on maternity experience. So we were kind of happy that happened. Within 24 hours of putting out their survey, 500 women responded. Now, one thing I must say is our survey was averaged 30 minutes long. Yeah, we had about 200 and something questions. Because we wanted to get so much information, but we believe that if we had less questions, definitely would have had more women. 77% of the women who responded to the survey were not pregnant. What we did is, because of the Embrace report, we wanted to make sure we collected the data around the UK, just like the Embrace report. So Northern Ireland, Scotland, London, the South West Midlands. Over 60% of the women who did our survey earned above the UK average. And the survey was done for women who were 16 to 45, and majority of the women who filled out our survey, 65% of them were 26 to 35 years old. With the survey, we surveyed women who were pregnant or gave birth within the last 5 years. So here are some key observations from the Black Maternity Experience Report. One thing is Black women do take part in the research. So Dr. Tinuke said earlier when Nadine Dorries said that Black women don't take part in research. They do. I believe it's all about who's behind the research and what the research has been used for. But because we are trusted in the community, we were able to get women to actually do our report, our survey that we had out. We only wanted to collect experience on Black and Black mixed women only. And we didn't want anything from any other women. We felt like this survey, we wanted to really, really focus on Black women or Black mixed women's experiences. And we did have a few entries from Asian women, but they wasn't able to fill out the rest of their survey because once they went through the first page and said they were Asian, the survey stopped. One thing we noticed is Black women complain less than Black mixed women, despite despite receiving poorer care. So when we did a survey, a lot of the women said that they were okay with their care, they were happy with their care. And then when we asked them to talk about their care, we realised that the care that they had was horrendous. And then what we saw with Black mixed women, they were not happy with their care. And when we heard what they said, compared to Black women, was I don't want to dismiss anyone's experience or anyone's care, but compared to mixed women, compared to Black women, it wasn't as bad. And what we realized is mixed women complained way more than Black women. And I asked my friend whose mum is white, her dad is Black, and I told her about this, and she was like, yeah, because she saw her mum, who's white, complaining all the time. So to her, it was a thing that if something doesn't go your way or something doesn't go right, you complain, and that's how you get your way. So she was brought up in complaining. And I think culture always also makes us believe that, you have a baby, you're healthy, your baby's healthy, that is it.
Just thank God and move on.
Yeah, just thank God and move on. And I think we need to do more in complaining or giving feedback and saying, no, actually, this is not right. I think a lot of times we are so used to receiving poor care that we will just sensitize it. It's just something that we know. I know if I walk in, this is how they're going to look at me. This is how they're gonna treat me. So it is what it is. You kind of just know when you walk into a place the kind of treatment you're going to get. Respondents earned above the national average. They were degree level educated and were either married or in relationship. There's this thing about, the reason why we have poor care is because we're all young mums and we live in council estates. We're not married. We are single. We're not educated. But our survey proved that wrong. And I was so happy that we were able to say that this is not it, because we feel like it's an excuse. It's easy to say, they're from low income families. That's why they receive the poor care they can't read. They don't engage with services. A lot of the mums that we spoke to engage in services. A lot of the mums that we spoke to were actually health professionals themselves, and they still receive bad care.
Sorry, and just off the back of that as well, you got to think if even people like Serena Williams and Beyonce, who are like literally the richest, most well-known Black women in the world, can report having bad experiences, how much less the average Black woman. So you've got to really question what's going on there within maternity and medicine. And here's a quote from the survey. So we did I can't speak. We did collect both qualitative and quantitative data. So we had the stats, but we also gave women the opportunity to write about their experiences. And I'm just going to read a few quotes from there. I had an episiotomy, which is she was cut and stitched back together. And her stitches fell out. She said she's high risk from infection due to her sickle cell. They kept refusing to have a look. By the time the doctor had looked, the stitches have fallen out and it was infected. This then triggered a sickle cell crisis. Next, please. One woman was told that she was big and strong, so there was no need to worry, whilst another woman recounted being told women like you should be able to take the pain. Again, going back to the myths and stereotypes I spoke about earlier on in the presentation about women being strong and being able to handle the pain. This is what health professionals are telling women at the point of them reaching the hospital. So what is it that women want? Well, at the end of our survey, what we did, again, like I said, we had an time for women to write out their experiences, and we asked them, what is it that you want to be seen done to improve your care, which is what informed our recommendations on the report. And women said that they wanted health professionals to stop making assumptions about their ethnicity. This is a very big one because it goes back into data collection, what you have, but also the fact that health professionals just make assumptions about where they may be from. I might be Black Caribbean, but I'm married to someone with a Nigerian name, so you just assume that I'm Nigerian, things like that. So stop making assumptions, just ask and allow us to self-select rather than making assumptions about where we may be from. Women also wanted more antenatal appointments, and they wanted more information about what their birthing options were. A lot of women just weren't told about where they can give birth. So, for instance, your experience about being asked where you have your baby.
I have two boys. My first pregnancy, I wasn't really told where I could give birth. So my second pregnancy, when I was asked, where would you like to give birth? I was like, in a hospital. And I kind of rolled my eyes thinking, where else can you give birth? Not knowing that there was an option to have a home birth, not knowing that in a hospital there's an option to have a full birth. I just assume you just give birth in a hospital because that's all I've ever been told. So women would need to know more about the options and how they can give birth as well.
Absolutely. Processes like induction should be explained properly. So like I mentioned in the beginning, I was induced, but I wasn't told what the risks were. I was kind of just told you can't leave this hospital without having your baby, and I was induced, and I wasn't told here are the risks, here are the benefits, the pros, the cons. If you do this, this will happen. If you don't do this, this could happen. So it was just almost like a forced thing. I feel like maybe if I was told what the options were, I would have been able to have made an informed decision about how I gave birth. But I wasn't told. So a lot of women also felt the same way, that they just weren't told what certain processes were, and they would like that to be explained properly. And also, very, very common here, women want to be listened to and they want to be heard. They want to say something and somebody actually listen to what they're saying rather than being dismissed all of the time.
Okay, so here are some of the things that are being done. So the government maternity disparity task force was established in 2020 to tackle disparities for mothers and baby and to reduce maternity and neonatal death. And this was co-chaired by Minister Maria Crawford, and at the time, Jackie Duntley-Bent, which was the
Chief midwifery
of the UK. So she looked after all the midwives in the UK. So what the maternity disparity task force, which we are also part of, at the moment, what they're focusing on is pre-pregnancy, so pre-conception, because they feel like if you look at the embrace report, a lot of the reason why some of the mums are dying were pre-existing conditions that they had, but that they were not aware of. So because of that, the maternity disparity task force are going to focus on that, which is all well and good, but the problem with that is only 40% of women plan their pregnancy. So it means the other percentage of women who don't plan their pregnancy, if they do become pregnant, now what? So myself and Tinuke was like, this is great, but for those who don't plan, what's going to happen to them? And also recently, so January the 17th of this year, the government are putting 50 million towards the maternity disparities. So which is great. We're still waiting to see where the money will be allocated to, but they said a lot of it will go towards research. So let's just see what happens with that. The good thing is there's a lot of acknowledgement, which is great. So a lot of acknowledgement. We're just waiting to see if there's going to be action towards that acknowledgement.
Before we round off, we just wanted to say that these statistics for Black women don't actually just end at mortality. There are so many more statistics outside of just the deaths, and either outcomes for Black women are even worse outside of maternity as well. So just to read a couple of them on here, for every death, there are approximately 100 near misses. So there's morbidity. So I think we brought some of those experiences out, those near misses, in our report. For every one person that does die, there are 100 people who could have died, and their experiences aren't really recorded anywhere. Miscarriage rates are 40% higher in Black women, unfortunately. This is quite worrying because they don't actually really know why this is happening. They just know that it's happening. Black women are also 2 times higher, have a 2 times higher rate of stillbirth. So it's not just the women that are suffering, the babies are suffering too. They're at higher risk of stillbirth. they're 25 times less likely to access fertility treatments than white people, and 7% less likely for that treatment to be successful. And we also know that postnatal depression and anxiety is higher in Black mothers. And as we mentioned, with Embrace, when you do look at the statistics, actually, you know that Black women are not dying from anything more than what white women are dying from. It's just at a higher rate, which doesn't make sense because we only account for a very small amount of the people that give birth. But within that, the biggest killer is, suicide, which goes into mental health and postnatal depression and all of these things as well. So within maternity, the statistics are quite dire. But again, outside of maternity, things like cancer, diabetes, and all of those other things, Black women seem to be at the bottom of the rung of the ladder for every single outcome. Next. And thank you so much for listening to us today. Here are our contact details. And I think there's time for some Q&A.
Yeah, that was I feel very overwhelmed and quite sad to hear this, really and truly. But it was really good to bring to our awareness and to our attention. Thank you guys so much. I'm sure we would have a lot of questions. We've even got some people in the chat that have shared some of their experiences as well. So before I try and take over, Angela, also your mics are you can turn them off. You can turn them on, and you can also turn on your cameras if you want to. So yeah, Angela, if you want to go ahead.
Yeah, hi, Tinuke and Clo, thank you for sharing. I'm so sad. I just think I'm sad at the moment. But I just wondered, you've been doing amazing work on a national level. Have you seen that's then, I guess, filtered down into local government and stuff like that? Because I find that is really great when you're doing big campaigns for everyone to see, but then it also doesn't always reach the local level. Yes, I just wondered what your thoughts were on that.
Yeah, no, absolutely. So local level, definitely when we're working with women directly within our campaign. So we've got things like our app that we recently launched, which allows women to have that information from health professionals, that kind of thing, to prepare for birth and after. But in terms of campaigning with MPs, part of our MP pledge is to get MPs to see what they can do in their local constituencies. Okay. So that is part of what we're doing on a local level as well as national. When they sign up to the MP pledge, we do, follow up with them and say, have you done this? What's going on? Can you give us an update? What are your constituents saying about the care that they've received? So that is definitely something we are conscious of and we're working towards.
Great. Sorry, can I just squeeze another question? Is around sorry, Andre, is around culture, because how do you find having conversations with mums that are very set on traditional ways of behaving around the NHS or white doctors and stuff? Do you feel like there's a challenge in trying to break those barriers and helping them advocate better for themselves?
I think you have things like white coat syndrome, which, when people are presented with health professionals, they just take whatever they say. Well, how you're grown up thinking that, well, the health professional is the one that went to school, they went to uni, they went to study for this. So why could they be wrong? How could they be wrong? So it's not necessarily about making it look like, oh yeah, all health professionals, they don't know about, there has to be a balance. If you feel like, I'm not too sure about that, again, advocating for a second opinion or just trying to ask them to explain what their reasoning behind that is. So for instance, when we put out a post about asking people, all right, do you know what a differential diagnosis is? And if you're not sure, if your GP is saying, or your doctor or your health professional is saying something, you can ask them, what's your differential diagnosis? How do you know that these symptoms aren't something else? Giving them that knowledge and that information for them to be able to self-advocate. It's not that the doctor's wrong, but it's just that if you don't feel like it's right, you have the right to question that. So bringing that into the forefront, I don't think people are really resistant to that. I think they understand that there are biases at play and there are things at play. So you just got to strike a good balance. I don't know if Chloe's got a different view. Yeah. She was just saying about, has there been resistance to like if doctors, because we grow up like just saying about like doctors, you don't question and stuff. So yeah.
Okay, thank you. Andre?
Hi both. Thank you so much for this. And yeah, I guess also like, and firstly, thank you for sharing the information, but also thank you for sharing your experiences and the kind of emotional weight and toil that comes along with being in that position and being vulnerable about things that affect your lives. I know that often costs a lot. I just had a question, I guess, kind of trying to connect the local and national work, because I imagine that although a lot of your campaigning, rightfully so, is at the national level, there's probably a lot of really rich and interesting learnings from the work that you've done and like your surveys that are probably quite applicable at the local level, particularly thinking about our role as commissioners of services at the local authority. And I'm just wondering, I'm not even really sure if there's quite a question here, but I guess for context, I should probably say a little bit what I'm like. My job and the team that I work with, we are part of our job is about supporting services to become more accessible for residents. And so I guess I'm just trying to connect the dots there to see if there's an opportunity to maybe speak offline about this, because I think a lot of our services could really gain from those insights. And I'm conscious that a lot of the barriers and things that make our services inaccessible for people, particularly, in this case, Black women, many of those learnings will apply across the board, that they won't just be like within this one context. As in, am I making sense there? Like, I have a feeling, because white supremacy and systemic racism and all of that is much broader than this context as well. So, yeah, I guess the question is like, maybe we can chat offline and see if there's opportunities there to kind of better support the work that you're doing and marry that up so that we can enable our services to be more accessible, and also see what role you might want to play in that.
Okay. I was going to quickly say, like I said previously, I'm the MNVP for St Thomas Hospital, which is Southwark and Lambeth. So I do a lot of work on the ground with Southwark and Lambeth, especially in the maternity units. So, and then South East London as well, which includes Greenwich and Kings and Lewisham. Because we're from those areas, it's easy for us to work in those areas, but we're happy to broaden the areas that we work in with the resources and what we offer women.
Thank you. Sharma, do you want to go next?
Yeah, I just wanted to say, so when our colleagues in our local hospital and our local children's services watch this video, what would you want them to do differently? What would your key asks be of them?
Trying to figure it out.
In children's services, you said, sorry.
Yeah.
Just thinking about like maternity services and early years services for mums, for example, like particularly just the stat at the end about the number of mums having postnatal depression really stood out for me as well, just given like the number of young people that go into our care system. So like, what would you want us to do?
Well, one of the things that you can do is tell mums about, or services about us, what we offer as 5 times more. Another thing is, I think what came up a lot during our presentation is listening to mums. I think a lot of the times we assume stuff or feel like mums know it or don't know it. I think try and listen to the mum and actually building that rapport. I will say, I don't know if you want to add anything else to it.
Yeah, I would say just maybe understanding where that person may be coming from, like culturally as well, because a lot of health professionals, if they don't understand the context of, where where Black women are coming from, the fact that we might not feel safe, or the fact that we might not feel like, well, do you even care enough, or are you just going to take my baby away if I tell you my experiences? Just being aware of that might be a good one, because it stops people from actually speaking up. So it's a weird one. When they speak up, they're encouraged to speak up. When they do, they probably get harsher sentences than their counterparts. So where do you kind of draw the line? I think the good middle people are the health visitors, are the people that can actually put things in place.
I was going to say also empower mum, make mums have that confidence. A lot of times with the events that we do, there's a section where we talk about empowering mums to take control of their health and their situation. I know as health professionals, I used to work in maternity, you know what's right in a way because of what you've read and what you've been told, and you can see the signs. But sometimes it's allowing that mum to come to that conclusion herself. And if she doesn't want to, it's okay, as long as you know you've done your best and you document everything you need to document to cover yourself. But sometimes allowing a woman to take control of her situation is better. Hope that helps.
Thank you.
Does anyone else have any other questions or comments that they want to share? No? Okay. So quickly, just more on a positive note, not necessarily positive, but I think I just wanted to kind of ask for your feedback. So since 5 Times More started, what's just some of the positive work that you've done with Black women around maternal health and the aftercare? I guess what were some of the positive responses or feedback or even success stories that you've had, if you'd like to share?
Yeah, well, it's not all negative. I know obviously our presentation can come across quite heavy because there's a lot of work. It's national level, local level, all of this kind of thing, and big reports but it's not all dire. We definitely do get very good feedback from the women on the ground who are just like, look, I took your steps, or I, did the hypnobirthing, or I spoke to you and you advised this, and then I went for it and actually had a really good experience. And even my second birth was perfect. That was in the middle of the pandemic. I had a really, really good experience because I had followed all of the steps for 5 Times More. So it's not all negative, definitely not all negative. And I think over the years we've been able to achieve some quite notable things, which is a right step in the right direction.
I was just gonna say on our Instagram and on our website, we also have positive stories. One thing we don't want to do is scare women and say, you're Black, so you're 5 times more, 3 times more likely to die, and offer no solution. What we want to do is highlight the statistics, but offer you support in terms of that you don't become a statistic. So what can you do to advocate for yourself and to not become a statistics? But we have a lot of positive testimonies, women feeling okay to give birth. Because before it was, I would get women saying, I'm scared to go to hospital, so I might never come out. And you don't want to hear that, especially when you hear your young mum saying that. Or there's a lot on race, and I hear a lot of times women saying, I don't want a white health professional because I'm gonna die. There's certain areas, you don't have a choice but to have a white health professionals because there's no diversity. What we're trying to do is by saying it's not about the race of the health professional, it's the individual health professional that looks after you. So what you need to do is make sure you're well equipped and you are knowledgeable. When you're knowledgeable, I feel like you get the best treatment only because you can ask for the best treatment.
And your options,
Yeah,
right?
your options, yeah.
Back to that point of women making informed decisions because they know all the options available to them and they know their rights. And so it's a positive thing. And I think we're proud of the fact that more people are coming to us and saying.
Actually, I was going to say something that we have done. We launched an app. We didn't speak about it. So we launched an app, and on the app there's a learning hub. So all things to do with pregnancy, and it's videos from health professionals who will talk. So we've got GPs on there, we've got midwives on there, we've got organisations on there. So there's an organisation called Kick Count, it's about reduced fetal movements, and it tells you and explains to you what reduced fetal movement is. The reason why we created the app is we realised that you only have 10 to 15 minutes with your midwives. So this app will give you more time and information on what you need and how your pregnancy should be. So the stages of pregnancy, breastfeeding, all of that. But also with the app, we create a community. So if you're pregnant and you're like due in January or July or whatever, somebody else who is due at the same time as you is in that group with you, so you can kind of talk and share information, because it takes a village to raise a child. So that's what we try to do with the app that we launched. We keep forgetting to mention it because we just launched it this year.
I mentioned it many
Did you?
times. Yeah.
Oh, well, I've gone. So why didn't you stop me?
No, because I didn't elaborate on it. So you elaborated on it. No. It was good. It was good.
No, that's really good. If you can, please do share the app with me, a link via email, and then I'll send it out to all the attendees here today, because I think that's definitely something that we can push forward within Westminster as well. I think I'm just going to read a comment from Fahida. It says, it is imperative that we push to educate healthcare professionals, and we should be starting with students, not just established staff, and across the board from junior to senior staff. We've collective, I guess what she's trying to say, we have a collective responsibility, and I absolutely agree. Just one more kind of round of anyone that has any questions or comments or feedback.
I was going to talk on that.
Yep.
So we definitely need to start with students. Students have like one slide on diversity, and we have students, and especially one in particular, who said to us during her lecture, in her first year, she mentioned, what does this look like on a Black person? I think was a particular condition. And the lecturer said, when you come across it, you will know. Well, what does that mean? Or there's another one where they were told the reason why Black women are dying is because they don't engage in services. That's what they were told at uni.
Terrible.
And this was in an area where it's predominantly white. So imagine when they come to like maybe work in a South London hospital, which is very diverse, they're just going to assume, oh, they don't engage in services, so I'm not going to bother telling them the full information that they need to know. So it needs to start from students. Yes, it's great that we tell health professionals who've been in the field for such a long time, yes, this is happening, but the students are the ones with the fresh information, with the
They're the future.
They're the future, but they're the ones with like, they want to create change. Yeah. So yeah, we need to start with students. Definitely students.
Yeah.
Thank you. Great. I think everyone's just saying thank you for your presentation. This was absolutely amazing. Thank you so much for your time.